Okay, I'm going to sanitize my, oh, can you see me? Okay. I'm going to sanitize my hands. It is me being the project. Okay, I'm going to display my MAR for my assigned patient. I have Oscar Simpson. So, cord here. Can you see that? It's not gonna focus. Of course. But this is my MAR. So I'm displaying it for Mr. Oscar Simpson. His date of birth was 10/28/1963, and he is allergic to pollen as well as codeine. And I'm going to check my MAR for for the medication scheduled. So he's going to be taking prednisone, 20 milligrams twice a day, scheduled for 10 a.m. and 6 p.m. Route is orally, dispensed through a tablet, as well as cephalexin, 500 milligrams every 6 hours, scheduled for 4 a.m., 10 a.m., 4 p.m., and 10 p.m. orally, dispensed by a capsule. So I'm also going to compare the MAR to the physician's orders, make sure that that is correct. Okay, so I'm going to scroll down here. Cephalexin, written order, dose and frequency is 500 milligrams every 6 hours, orally for 4 a.m., 10 a.m., 4 p.m., and 10 p.m. So that is correct. And I'm going to also compare, excuse me, prednisone, written order, dose and frequency is 20 milligrams twice a day, route is orally, scheduled for 10 a.m. and 6 p.m. Dispensed through a tablet orally, excuse me. Okay, so I've done that. Next, I verified my physician's orders. Oh my goodness. Oh, my med cart. Okay, have my med cart. I'm going to get my medications out and compare them to the MAR. Okay, so we have Mr. Simpson, cephalexin, 500 milligram capsules, orally. Yes, that is correct. Scheduled for every 6 hours, so 4 a.m., 10 a.m., 4 p.m., and 10 p.m. Okay. And the expiration date is 10/28/2021. We also have prednisone, 20 milligram tablets. Okay, Mr. Simpson, 20 milligrams twice a day, scheduled for 10 a.m. and 6 p.m. orally. These are dispensed orally as well. Okay, perfect. And the expiration date is 28/2021. So we have our medications. Okay, next I'm going to consult my David's drug guide, find out a little bit more about them. So for cephalexin, our most serious side effects are seizures, Clostridium difficile, associated diarrhea, Stevens-Johnson syndrome, anaphylaxis, and serum sickness. Most common side effects are diarrhea, nausea, vomiting, rashes, pain, and phlebitis. We want to be on the lookout for renal impairment, giving this PO for adults. Want to give them 500 milligrams every 8 to 12 hours or 250 to 500 milligrams 12 to 24 hours, so he's good on that. And for our nursing assessment, we want to observe the patient for signs and symptoms of anaphylaxis, rash, pruritus, laryngeal edema, and wheezing. We want to monitor bowel function as well as assess patient for skin rash frequently during therapy. And we want to instruct the patient to notify a healthcare professional if rash or fever and diarrhea develop, especially if diarrhea contains blood, mucus, or pus. That was for cephalexin. And for prednisone, some of our most serious side effects are going to be pheochromocytoma, as well as peptic ulceration and thromboembolism. And our most common side effects are going to be depression, euphoria, hypertension, acne, decreased wound healing, ecchymosis, fragility, hiatusm, petechiae, adrenal suppression, anorexia, nausea, muscle wasting, osteoporosis, and Cushingoid appearance. Okay, our nursing implication, our assessments, we want to assess for signs of adrenal insufficiency, hypotension, weight loss, weakness, nausea, vomiting, or anorexia. We want to administer this with meals to minimize GI irritation. And we want to teach our patient that stopping the medication suddenly may result in adrenal insufficiency, anorexia, nausea, weakness, fatigue, dyspnea, hypotension, and hypoglycemia. Okay, so after that, I want to do my second check. Is it my second or my third? I want to check again on my medication with the MAR. So we have our prednisone, 20 milligram tablets, prednisone. Okay, so our patient, Oscar Simpson, dose and frequency, 20 milligrams 2 times a day at 10 a.m. and 6 p.m. orally. These are oral tablets. And he does need 20 milligrams, or these are 20 milligram tablets, so there's no need for calculations. And then we have cephalexin, 500 milligram capsules, and Mr. Simpson needs cephalexin, 500 milligrams every 6 hours orally. These are oral capsules at 4 a.m., 10 a.m., 4 p.m., and 10 p.m. Expiration date is also 10/28/2021 for both of these. Okay, so there's no calculations needed for either one of those because those are the exact doses that my patient is going to need. So I'm going to gather all my equipment needed. I've got my medication, my med cup, my David's drug guide. Okay, I'm going to knock before entering, sanitize my hands. Hi, Mr. Simpson. My name's Melinda. I'm going to be your student nurse today. Can I have you verify your name, date of birth, and any allergies that you may have? Excuse me. Okay, I'm just going to check your armband real quickly. Okay, Mr. Simpson, you said you were allergic to pollen and codeine. Can you tell me what kind of reaction you have? Okay, I'm just going to make sure that everything is documented in here and is correct. Okay, so before I get started, Mr. Simpson, are you comfortable? I'm going to be doing a oral med pass today. Do you have any questions? No? Okay, I'm just going to make sure that your bed is all the way down, your wheels are locked, your handrails are up, your collie is right here next to you. Are you comfortable? Would you like me to sit you up on your bed? Okay, there's no clutter on the floor. Just going to close this curtain for privacy real quickly. And before I get started on your med pass, I just want to go over some things with you real quickly, perform any assessments with you. So, Mr. Simpson, today you're going to be taking cephalexin as well as prednisone. I just wanted to go over with you. So we want to observe the patient for signs and symptoms of anaphylaxis, rash, pruritus, laryngeal edema, wheezing, monitor the bowel function, and assess patient for skin rash frequently during therapy. Have you had any of those complications, Mr. Simpson? No? Okay, perfect. And also, Mr. Simpson, we just want to tell you that we want you to notify a healthcare professional if rash or fever and diarrhea develop, especially if diarrhea contains blood, mucus, or pus. That was for cephalexin. And for your prednisone, we just want to assess for signs and symptoms of adrenal insufficiency, hypotension, weight loss, weakness, nausea, vomiting, anorexia, lethargy. Have you had any of those complications, Mr. Simpson? No? Okay, perfect. And we do want to give this with food. I know it's 10 o'clock, kind of late for breakfast, kind of too early for lunch, so I did bring some snacks for you in case you want to eat that along with your medication. And Mr. Simpson, we also want to tell you that stopping the medication suddenly may result in adrenal insufficiency, anorexia, nausea, weakness, fatigue, dyspnea, hypotension, and hypoglycemia. So I want to do my assessments as well as patient teaching, and I want to do my next check on my meds just to verify again. And we do have cephalexin, 500 milligram tablets, cephalexin, 500 milligrams every 6 hours, 4 a.m., 10 a.m., 4 p.m., and 10 p.m. orally. This is a oral medication. And the expiration date is 10/28/2021. And we also have prednisone, 20 milligrams delivered orally, and he is scheduled to take prednisone twice a day, 20 milligrams orally, at 10 a.m. and 6 p.m. So there is no calculations for either one of these. They're both the doses that he needs. Expiration date is also 10/28/2021. So I'm going to open my medication, make sure not to touch it with my hands. I just want to put it in my medication cup. Okay, make sure I don't touch it with my hands. Okay, so I see that my medication has fallen onto my med cart. I'm just going to grab some gloves and pick it up. I don't want to touch it with my hands. This is a whole ordeal. Oh my goodness. Okay. Oh, now I can't see me at all. Okay, I'm going to grab my medication, gloved hand, put it in the cup, and discard my glove, sanitize my hands. Okay, Mr. Simpson, I'm going to hand you your medication now. And I also have some water for you. Here's your medication. Here's some water. I'm going to stay right here with you until you're all done with that. So just let me know when you're done. I'm going to clean up my area. Okay, all done. Perfect, thank you very much. Okay, and then I'm going to make sure that I document the medications taken as well as the assessments done. And Mr. Simpson, before I leave, do you have any more questions for me? Are you comfortable? Okay, I'm just going to make sure that your bed is all the way down, your wheels are locked, your collet is right here next to you, your bed rails are up, there's no clutter on the floor. Do you want me to put the head of your bed back down for you? Okay, are you comfortable? Okay, I'll be back in a couple of hours to give you the rest of your medications, okay? Just going to open the privacy curtain, sanitize my hands. Thank you, Mr. Simpson.